My name is Stefano Dalmiani, and the head of the bioengineering department of Monasterio Foundation. Monasterio Foundation is a network of public research hospitals, and we are piloting the xShare yellow button using as a platform our patient portal. About the first question, the implementation of the xShare button is an important step for digital health maturity in Italy. What are the opportunities you foresee? Well, the opportunities is related to the capability of the patient to really use the information that we can deliver using electronic formats. Because nowadays we are delivering paper documents and digital documents contained in the national EHR system, but the structure part, the structure report are not available for the patient. So the xShare button provides a unique opportunity for the patient to use their own information, just like the paper documents. So give the document to the people they want or to the healthcare professional they want. Of course, they have to keep some quality procedure or safe procedure in order not to lose or to diffuse the document to somebody that isn't intended to be the recipient of those documents. But this is up to the patient. The second question, can you briefly describe the steps taken for the implementation of the xShare yellow button in the Italy context? Well, the steps taken was for us something attached to our EHR system. In Monasterio Foundation, we have an EHR system since 1999 that collects all the information about inpatient and outpatient care. So we had to connect the patient platform, the patient portal with our EHR system, converting the information contained in the hospital's EHR into the EHR exchange format that is namely EHRxF file. So the steps was to develop some conversion procedures from the EHR system side and then connect this procedure with the patient portal. About the first question, how do you envision this to function in your settings? Well, we plan to use the yellow button after patient discharge because we usually provide the electronic document but in a PDF format to be readable into the national infrastructure, because that is the national format chosen by the Health Ministry, and enhance this PDF format with something that represents the structured content that can be processed by other healthcare providers directly. Of course, the structured content follows the EHRxF format. About the first question, how does the implementation of the xShare yellow button align with the EHDS regulation for patient access to their data? Well, the EHDS regulation is pretty new. So currently, we don't have precise constraints or regulation to be adopted in Italy for the implementation of the EHDS articles, specifically perhaps a few articles that commit the healthcare provider in providing some information that can be directly accessed by the patient and that can be owned and controlled by the patient. So currently the EHDS is a promising architecture that will support data collection by the patient for the care of the patient, but specifically also for research, because Monasterio is also a research facility, research center. So we need also to manage health information related to our research protocol. The last question is, what are the next steps and barriers to overcome towards this direction in the near future? Well, we have two different levels of barriers. First level is represented by the medical device regulation, because we need to understand the impact of the implementation of the xShare yellow button for the certification of our system, because we have our electronic health records certified as medical device class 2B. And we need to understand if the implementation, the yellow button, needs to extend the functionality of the medical device. The second step might be to have a more precise regulation, talking about the implementation of the EHDS, specifically for the diffusion or usage of research data. Of course, also in application of the GDPR, talking about anonymized, but many times also pseudonymized data that can really support clinical research.